Foot abnormalities resulting in knee pain. Knee arthritis and high heels. It is fairly common knowledge that the human foot was not designed to maneuver in high heel shoes. Because of the abnormal angle in which it places the foot, numerous problems can develop both in the foot and ankle joint. Did you ever stop to think of the impact that high heels can have on the knee joint? In this article, we will discuss how the elevation of the foot from this type of dress shoe may adversely affect the function of the knee joint. Those that develop osteoarthritis, wear and tear arthritis, of the knee include women twice as much as men, people who are overweight, those with muscle weakness in the leg, those with a history of knee trauma. The biomechanics of knee osteoarthritis. The area of the knee that is most affected appears to be the medial, or inside, portion of the knee. Cartilage damage as well as deterioration of the surrounding soft tissue occurs over time. This damage occurs from both a combination of direct impact on the knee when walking, as well as torsional forces, twisting forces, within the knee joint. Research into this problem began in the 1990s, led primarily by Casey Kerrigan MD, an orthopedist, who wondered why women get knee osteoarthritis at a greater incident than men. Certainly, since women wear high heels and men do not, that would seem to be an area that needed to be researched. In normal gait, when your heel first hits the ground, you land on the outside of your heel. As your foot hits the ground, your body weight travels along the outside of the foot, and then at the level of the ball of your foot, the weight is transferred across the front of the foot, and as your foot leaves the ground, you push off with your big toe. In her research, Dr. Kerrigan found that stilettos altered the ability of the foot to adapt to the changes necessary to function in a normal gait. She even found that high heel shoes with a broader base were even worse. Pronation and knee osteoarthritis. For the most part, the purpose of an arch support is to reduce pronation, and there are numerous foot and ankle problems that require a reduction in pronation to alleviate pain. However, some researchers have found that this same reduction in pronation may increase knee pain, so much so that some studies claim that by increasing pronation in individuals, by adding a lateral heel wedge to their shoes, actually improved knee pain in their studies. This appears to be contrary to my training and observations over the years. One of the things that excessive pronation does is increase the torsion at the level of the knee joint. With excess pronation, the lower leg excessively internally rotates, while the upper leg begins to externally rotate, and you are left with a twisting motion, torsion, at the level of the knee joint. Shoes and osteoarthritis, what should you do? If you suffer from knee arthritis, particularly on the inside of the knee, certainly considering a change in shoe selection may go a long way in improving your quality of life. The problem with most of the research that has been done so far is 1. The studies for the most part were done on small samplings of people. 2. Other considerations such as being overweight or having suffered trauma to the knee years ago may not have been taken into account. 3. Foot structure and skeletal makeup varies from person to person, and there can be great variabilities in this aspect. 4. Most people do not wear the same shoes day in and day out, and certainly shoe styles, heel height, change over the years. The biggest concern is that by drastically changing your shoe style, even though your knee may feel better, you may actually be exacerbating some other problems. Read the complete article at www.foot-pain-explained.com/knee-pain.html